Addiction is not always something you can see or picture. Perhaps you can see some signs that someone has overdosed, but you cannot always see the effects of addiction. People can get addicted to a synthetic drug like prescription painkillers, for example, Vicodin, Oxycontin, Percocet, morphine, and heroin. Addiction is a disease that has become very widespread in the world, and especially the United States. Often, patients take their medications as prescribed by their doctors and become addicted to the drug. Opiates, as our painkillers for example, can change the way the chemicals like endorphins are naturally produced and how they affect the brain. It's this change that causes that nice, warm, and good feeling the user initially gets. But over time, opiates can trick the brain into stopping the production of endorphins naturally, and people become very much dependent on them to feel good.
I used them because I was addicted to them. I used marijuana, Percocet, Vicodin, Oxycontin, different types of amphetamines like Klonopin, Xanax.
Addiction can happen to anyone. It can affect a worker, a parent, a child, or a promising young college student. It can happen to a best friend or a family member.
I got in a car accident when I snapped my leg in half. They gave me like a whole ton of Percocets and Vicodins. I used opiates I was addicted to opiates for about 4 to 5 years. When I was addicted, it was an everyday thing. It affected my family more than my friends because my friends were already all doing them. So it was kind of just like a hand-in-hand thing with them, but with my family, I don't know, I didn't really see them as much. And they could obviously tell that I was on them.
As distressing as opiate addiction can be, you could take some simple steps to protect yourself and your loved ones.
If you have been prescribed opiates by your doctor, do not use the entire prescription if you do not feel you need to. When actively using the prescription, make sure it's in a secure area where it's out of the reach from children and teens. Properly dispose of the leftover medication so they do not fall into the wrong hands. Learn to recognize the signs of addiction to opiates. Ask your physician to reduce the dose and the number of pills whenever possible. Ask he or she to prescribe an alternative to opiates.
After I stopped getting the prescriptions from the doctors for my leg, I started picking them up on the street, selling them, making money and doing them on the side. I tried quitting myself for about a year. The whole last year I was using them, and I couldn't really do it on my own. But then I got arrested for selling opiates, and they sent me to, not like a rehab, but like a counselor. And that helped me out a lot.
Many people who are addicted to opiates do not realize the level of addiction they have reached. The first step for an addict to overcome their addiction is for them to understand the effects that their situation will have on their lives and what the consequences will be if they do not seek multiple prevention methods. To properly dispose of the unwanted medicine, call your local health department. In Lowell, you can call 978-970-4010. Think twice before you choose opiates, whether for pain or not. Continuing the use can affect not only your life, but others who love you and care about you. Remember, life is too precious to lose to addiction. Learn to feel good the healthy way.